We're ready.
The endoluminal laser ablation procedure is performed in the physician's office under local anesthesia. This minimally invasive technique allows the patient to return to normal activity the following day and produces a much more appealing cosmetic result compared to traditional surgical methods. The patient's vein has been mapped via ultrasound and is prepped and draped. Minimal instrumentation is required to perform this procedure. The Dornier laser fiber is connected to the laser. Once the fiber is connected, a red helium neon aiming beam can be visualized. The site for the percutaneous stick is infiltrated with plain local anesthetic. Under ultrasound guidance, the greater saphenous vein is accessed via a micropuncture needle. Once inside the vein, a small guide wire is inserted and the micropuncture needle is removed. An introducer sheath is then inserted into the vein and the small guide wire is removed. Next, the larger J wire is inserted under ultrasound guidance. The introducer sheath is removed and replaced with a long sheath appropriate for the length of saphenous being treated. The J wire is removed and replaced with the laser fiber. Position of the laser fiber is confirmed via ultrasound and is placed approximately 1.5 to 2 centimeters distal to the saphenofemoral junction. Anesthetic solution is administered through a spinal needle attached to a pressure bag. The solution is infiltrated into the fascial sheath that surrounds the saphenous vein. Anesthetic solution not only provides an analgesic effect, but also creates a fluid heat sink around the vein to protect surrounding tissues. Typically, 250 to 500 cc's of anesthetic solution is administered. Ultrasound is used to confirm placement of the anesthetic solution within the fascial sheath. Once the anesthetic solution has been placed, the room lights are dimmed, and confirmation of the laser fiber is reaffirmed by a visualization of the red aiming beam seen through the skin. Once the laser fiber placement is confirmed, the laser settings are adjusted for continuous or pulse mode. The LPS protection system is turned on, and the energy dosage and duration can be adjusted. A record of treatment parameters including energy dosage, time, and pulses is automatically recorded in the laser's computer. The Dornier D940 FlexiPulse is the only laser available with LPS, also known as the laser fiber protection system. When laser fibers develop char, they become too hot and can create microperforations in the saphenous vein, which can lead to post-procedure ecchymosis. The LPS system detects the development of char at the end of the laser fiber and alerts the physician. The char can be removed through a variety of simple methods. With the LPS activated, optimal heat generation is achieved, which reduces the formation of char and thereby significantly reduces unwanted microperforations and post-procedure ecchymosis. With the proper laser settings adjusted, the laser fiber placement confirmed via ultrasound, and the patient comfortable with the local anesthetic, the laser begins firing. The laser fiber and sheath are pulled back in 2 to 3 millimeter increments, resulting in a short duration total pullback time of approximately 2.5 to 3 minutes, depending on the length of the saphenous vein. In a darkened room, one can usually see the red aiming beam through the skin. The sheath and laser fiber are withdrawn, and as demonstrated here, virtually no char has developed on the end of the laser fiber. Steri strips are placed over the puncture sites. No sutures are necessary. The patient is placed in a compression dressing consisting of ABD pads, Kerlix, Coban, and an ACE wrap. Care is taken to protect the ankle from irritation. The compression dressing is worn for approximately 48 hours, followed by 2 weeks of compression stockings. This patient is shown at 1 week post-endoluminal laser ablation procedure. This patient is 2 weeks post-endoluminal laser ablation procedure and ambulatory phlebectomy. This young woman is 4 weeks post-endoluminal laser ablation procedure. 2 months post-endoluminal laser ablation, ambulatory phlebectomy, Transcutaneous laser treatment of spider veins and sclerotherapy with outstanding results is demonstrated here. This patient is 6 weeks post-endoluminal laser ablation procedure, resulting in complete ulcer resolution and closure.